The actual mold test that we perform in their office is a blood antibody test, which tells us whether or not the mold toxin is actually binding to the proteins in our body, and that is what can actually make us sick. The test that most doctors do perform is an allergy type test, which is a totally different type of test. There are other healthcare providers that may do what's called a mold urine test, and what that test does is actually tells us whether or not your body has the ability to excrete or actually metabolize and get rid of any mold that may be in certain foods that you digest. And that's actually a good thing if your body can get rid of it. It really has nothing to do with whether or not those molds are causing any ill effects in your body. So if you've been dealing with chronic health related issues that do not get better despite how many types of treatments you've had, and you think that you may have had a history of being exposed to water damaged buildings or workplaces, it may be beneficial for you to be tested, since these mold illnesses can masquerade themselves as a lot of other health related issues that go completely undiagnosed. If the blood antibody test does come back positive, the next step would be to determine where that exposure may be. Now, this could be a very expensive process to determine where that exposure is, so I would always suggest getting the blood test first. Obviously, if the test comes back negative, there's no need to go through a home evaluation.